31-year-old man comes to the physician because of a 1-month history of pain in his right arm and numbness and tingling on his right hand. 1 month ago, he quit his job as a painter because his symptoms worsened whenever he tried to reach above his head. So he has no history of serious illness and takes no medications. He does not smoke and drink, and he drinks 2 beers daily, and vital signs are within normal limits. And physical examination shows decreased sensation to fine touch in the fourth and the fifth fingers of his right hand. Radial pulse intensity decreases when the patient's right arm is abducted and externally rotated. Which of the following is the most likely cause of the patient's symptoms? Okay, so this question. Okay, so here, what is the striking point that that pops up in the question? This says that, okay, where is it? Yeah. So radial pulse intensely decreases when the patient's right arm is abducted and externally rotated. Does anyone know what that test is called? Okay, it's you needn't learn the names of the test, but I'm just trying to tell you that here we have neuropathic symptoms, like there is pain in the right arm, there is numbness and tingling of the right hand. But another thing we have to check here is that radial pulse intensity decreases. So that shows that there is a vascular component as well. So we have to think about a condition which has both neurological as well as a vascular component, right? So carpal tunnel syndrome, it's a pure neurological thing. And we all know what is the typical carpal tunnel symptom. So that doesn't match with the symptoms that the patient has, right? So this patient has in the fourth and the fifth finger. So that's not about carpal tunnel syndrome. So, and polymyositis will be an autoimmune condition which affects the muscles. So the patient typically presents with progressive muscle weakness. And obviously, you might confuse here that the symptoms worsened whenever he tried to reach above the head. So if it was polymyositis, of course, they would mention that the patient has difficulty lifting the hands above the head. But here it says that his neurological symptoms like numbness and tingling is what increases when the patient tries to raise his hands above his head. So there is a vascular component too. So we have to, an upper trunk compression, again, we know that it is Erb's palsy, and cervical disc protrusion, even that's a pure neurological thing. So the only thing which has both components here are neurological and vascular components will be cervical rib. And what is the syndrome called, which is caused by the cervical rib? Okay, so this thoracic outlet syndrome. So we have this very peculiar thing. We have neurological symptoms while the patient will have. So the question definitely they will give a clue about a vascular compromise, not just neurological symptoms. If there is a vascular compromise as well, then go ahead and think about thoracic outlet syndrome. So let's also take note of some other conditions which can cause thoracic outlet syndrome. So it's here given right over here. Okay, so Pancoast tumor, which is a lung tumor, okay, which occurs in the apex of the lung, and muscular anomalies like supernumerary scalene muscles and neck muscle hypertrophy, and trauma like clavicle fracture. So just have a look at the other causes as well, but we all know cervical rib is the most common cause of thoracic outlet syndrome. All right.
Thanks for watching. Please give a thumbs up and subscribe for more.